You know when you just had a baby and everything in your pelvis feels really weird? You don't actually know what's normal. You don't know what things are supposed to feel like. There might feel like there's like something inside your vagina. You might feel like things just are weird and you want to totally disconnect. If you feel that, I want you to tune into this video and we're gonna go through everything you can do to start healing your perineum, healing your pelvic floor in order to help you feel much better and get you on the road to recovery much faster. I'm gonna give you 3 tips here. And before we even dive into the tips, I wanna talk about a little bit more about the symptoms. After you've pushed a baby out vaginally, there's oftentimes tearing that occurs. You could have a 1st or 2nd degree tear, or a 3rd degree tear, or a 4th degree tear. The 3rd and 4th degree tears go a little deeper and closer to the anus, which means that you might have a harder time controlling your poop or farts after you've had a baby. But that can hold true even if you had a 1st or 2nd degree tear. So the 1st and 2nd degree tears look a little bit different. So here is the vulva, and when you have a tear, it's usually within this area. So if it's a 1st degree tear, it's just a little bit outside of the muscle. It might require a stitch, it might not require a stitch. The 2nd degree tears always usually require stitching, and they go to the perineal body. That is this area right between the vagina and right between the anus. The 3rd degree tears are gonna go into the external anal sphincter a little bit. So they're gonna get some of the muscle fibers around the anus. The 4th degree tears are gonna go all the way to the anus, meaning that it is torn from the vagina down to the anus. And so those are definitely gonna require stitches, and sometimes they're gonna require surgical intervention to help reconstruct the area and rebuild the tissue. Regardless of whether you've had 0 tears or a 4th degree tear, you can have achiness in this area after birth. A few things to start. If your provider has said, yes, you can do sit baths, starting with some sit baths can be a great way to nourish this area. You can use Epsom salt baths. They have amazing postpartum concoctions that you can sit in just a very shallow bit of water to help soothe that area. And so you can do those sit baths for about 5 to 10 minutes and just helping nourish that area. The other thing you want to do is you want to rest. You don't want to be doing a lot of lifting and standing and bending and squatting. Now, I know that's hard when we have just had a newborn, and so it's really important that we aren't doing a ton of that. Lifting and bending and squatting takes a lot of tension and starts putting a lot more force through these tissues. So rest is really important, especially for the first couple weeks after these tears. The next thing you can do is to breathe. So I'm going to go through some breathing sequences that you can do to start to heal this area. So let's get into those now. The first thing you want to do is try to relax everything between your legs. And then the very first breath pattern you're going to start to do is going to be to breathe into your abdominal region. So you're going to take a nice deep breath into your belly, exhale, and let it go. You're not forcing anything open, but you can start to think of, okay, if I was clenching my anus, can I deep breath in and think about opening my anus with the breath? So you're going to deep breath in and open anus, open pelvic floor, exhale. You're going to get some natural recoil here. Inhaling and opening, exhaling and letting everything go. The second breath pattern that you're going to do is you're going to let your legs fall out to the side here, and then you're going to do some nice deep breaths into the pelvic region. So you're going to be here, and just like we were breathing into our anus before, now with our legs out to the side and feeling some stretch through here. Probably not the best to do it with jeans on, but yoga pants or just laying in your pajamas in bed. Taking a deep breath in here, exhaling and letting it go. Allowing the air to fill the abdominal cavity, exhaling and letting go, inhaling and opening. Inhaling, pelvic floor opens. We're allowing the legs to fall out to the side. If this is too much stress on the perineum itself, or on your stitches. You can put pillows underneath the sides of your legs to support the muscles or to support the tissue that's healing. So these are the two types of breath patterns that you're gonna wanna go to in order to start healing these tears right after you deliver. The next thing you can do for tissue healing, and this can start right away postpartum, is red light therapy. Red light therapy is amazing for help healing the tissue, healing the wounds. So what you would do is you would take our last breathing position and lay underneath lights and have that light penetrate the tissue. When we're talking about healing the skin, we need the collagen production to happen, but because the tears are happening at not just a skin level, but also at a muscular level, the red light therapy penetrates deep enough in order to start stimulating collagen synthesis and bringing blood flow back to the tissue and regenerating the tissue. The red light therapy can help tremendously heal the perineal area, and I highly recommend it. We offer this at our clinic here, but you can get one for your home, and they have great home applications. I will put our affiliate link at the end of this video so you can see for yourself what might fit in your house. And just even the smallest unit they have would be great to help set up in front of the perineum as a way to start tissue healing. Side note, it's not just an investment for the first 6 weeks. Red light therapy is amazing and has effects of stopping and preventing postpartum depression and lessening the effects, so you don't need medication. Of course, you want to work with a professional, perinatal professional if you are experiencing postpartum depression, but red light therapy has been shown in multiple research studies to have a very great effect on managing depression without the use of medication. The other thing that you could use the red light therapy for is just your face as well. So if you are interested in the benefits of anti-aging, red light therapy is amazing. So that could just be a little side use as you think about investing in one of these for your homes. All right, doing these things postpartum can help tremendously heal your perineal area so you don't have to suffer so long with tears that don't heal, and just having a prolonged healing, maybe to help you sit longer, quicker. And then once you get to your 6-week mark, you can really amplify the healing by working with a pelvic expert physical therapist and or doing our postpartum online program, which will be dropping here in the spring of 2024. Thank you for joining me. I hope you tune into more videos, and we have a lot of postpartum healing videos that can follow this one, along with like and subscribe to us on YouTube. We come out with a ton of content. We drop 2 videos a week, and we want to support you through your prenatal journeys all the way through postpartum, and to help you live the best life as a woman in your body and optimize your health and wellness for a lifetime. Please drop in the notes any questions you have. I would love to know how far postpartum you are. If you have any questions specifically about your healing, please drop them in the comments, and I will respond exactly to you. Take care. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy. See you next time.